Imagine after a long wait you finally get your hands on a COVID testing kit. Imagine you've been feeling ill and want to know if you're okay. Now imagine you're blind.
It has no markings on it. And again, this is a cardboard box. So, boxes of Band-Aids have Braille on them now.
Come on over inside the tent.
For many disabled people, the surge in testing has left them behind. If you're blind, and 1 million people in the US are, then simply working out what to do is a challenge.
There were testing centers that were drive-through only. And of course, blind people don't drive. We do have, as a matter of national public policy, the idea that people with disabilities are supposed to be integrated and included. So why is there nobody thinking about on the front end before things become a problem?
Pandemic restrictions were hard on almost everyone, but even more complicated for those who are disabled. There is the Americans with Disabilities Act, the law's intention that every American has the same rights and opportunities as everyone else. It gives people a sense of independence and dignity.
During the pandemic, we have seen all 50 states operationalize what's called crisis standards of care. And these are standards that a hospital uses to determine who gets access to treatment in times of a shortage of, of medical resources. And so states have used disability as a means of saying, you know what, your life is not worth living, it's not worth saving.
In fact, 1 in 4 adult Americans has a disability defined as a physical or mental impairment that impacts a major life activity. And long COVID could see those numbers rise dramatically.
You may be seeing people with long COVID who are experiencing things like fatigue, reduced lung capacity, brain fog, as well as individuals who have had significant stress and trauma throughout the pandemic who are now having to adjust to life with a psychiatric disability.
The White House has responded to criticism and made some changes, including recommending to drug companies that they make testing easily accessible for everyone. But things aren't going to change overnight. There will be a lag, and that means for people with disabilities, it's going to take longer to get back to normal. Alan Fisher, Al Jazeera, at the White House.